morning, family and friends. Today we will continue the discussion about colon cancer screening. I am sure you have seen the commercials about the Cologuard test. Let's look at it and compare it to the colonoscopy. Cologuard is a stool DNA test that uses a stool sample to look for signs of colon cancer. The test checks for changes in the cell's genetic material or abnormal DNA. Certain DNA changes are a sign that cancer might be present or that it might happen in the future. The stool DNA test also looks for hidden blood in the stool. If something concerning is found on your stool DNA test, you will more than likely need further tests, and your healthcare provider will probably recommend a colonoscopy. This test is meant for people who have an average risk and who have no symptoms. If you are considered at an increased risk of colon cancer due to your family history, genetic mutations, or other risk factors, or you have symptoms, then you are not eligible for the Cologuard test and you should have a colonoscopy. The Cologuard test results are either positive or negative. If the test comes back negative, that simply means no abnormal DNA or blood was found in your stools, and it is recommended to repeat the test every 3 years. However, there's an 8% chance that you will get a false negative result, which means your test came back negative when it was actually positive. If the test comes back positive, it means the test identified colon cancer or precancerous polyps. However, there's a 13% chance that you will get a false positive, which means the test came back positive when it was actually negative. If you have a positive test, the next step is to get a colonoscopy. The biggest disadvantage to the Cologuard test is the level of accuracy. As mentioned earlier, the colonoscopy is the gold standard because the entire colon can be directly visualized for polyps, and if detected, they can be removed all during one procedure. The biggest advantage of the Cologuard test is that it does not require sedation and preparation, and it is not invasive. Moreover, it is considerably less expensive. If you have been putting off a colonoscopy because you are apprehensive about having a procedure, consider getting the Cologuard test. With colon cancer on the rise, it is imperative to get tested by one of these methods. So speak with your doctor sooner than later to determine the best option for you. And please join me next Tuesday when I will discuss how to mitigate your risk of developing colon cancer.